Hi everyone, welcome to the class of Pediatrics. We are discussing pediatric orthopedics and you are with me. I am Dr. Parv, your pediatric faculty. Let's quickly start with the orthopedics, and the topic of discussion is Legg-Calvé-Perthes disease. Now Legg-Calvé-Perthes disease, what does this mean? See, the name is Legg-Calvé-Perthes disease, but then you should know that this is also called as coxa plana. It is also called as coxa plana. What is the meaning of coxa? Coxa means hip and plana means it is plane. Okay, so coxa means hip and plana means plane. So plane hip is called as coxa plana. So what happens actually? See the proximal femoral epiphysis. So can you see this? Yeah. So this is the epiphysis bone, of course, and there is a proximal epiphysis. So this is the proximal epiphysis which is there. So proximal femoral epiphysis is going to have the idiopathic avascular necrosis. Idiopathic avascular necrosis of the proximal femoral epiphysis which is going to be there. Now why it is happening? Because there is disruption of the vascular supply that leads to avascular necrosis, and once it is revascularized, okay, there is epiphyseal resorption which is occurring. There is a collapse which is going to be there, and of course the deformity is going to happen. So basically the proximal part of your epiphysis is gone, okay, femoral epiphysis, and that's why it is gone, because of the avascular necrosis. Although the revascularization repair happens, but then the deformity like collapse and the deformity, the collapse and epiphyseal resorption occurs. So when does it going to occur? So remember, it's called as Perthes. So the spelling of Perthes is P-E-R-T-H-E-S. That means it is approximately 7 letters. So 7 years is the age of presentations of Perthes, and of course P for Perthes, P for, you can remember my name, I am a male. So Perthes disease is something which is more commonly seen in males rather than females. Now coming on to two things, again you can remember my name starting from P, surname starting from L. So P for positive family history, L for low birth weight, okay, and then other thing, smoke. Although I don't smoke. Associated with ADHD, yes, this is a trait of mine, if you can remember, okay. So please remember, smoking and ADHD are also associated with Legg-Calvé-Perthes disease. So what happens actually, I have told you that both of them are, either it be Perthes or it be your SCFE, that is slipped capital femoral epiphysis, both of them are going to have limp. But please remember, Perthes is a painless disease, okay. Again, I have told you my name, so you can remember the initials of my name, P and L. That means P for pain, L for less. So Perthes is going to have a painless limp which is going to be there, and the location of the pain is actually the femur actually, so the hip, the groin, the thigh, and in fact it can even go to the knees as well, okay, it can even go to the knees as well. So what will be there? There will be hip stiffness that is going to be there, and that is why there is problem in the internal rotation, problem in the abduction, and of course lately, since the child was not properly walking, the child can have a limb length discrepancy, okay, because in Perthes disease the child is giving entire weight on the normal limb, so the limb which is not working, the muscles of that limb are going to have atrophy, and since the atrophy is there, my dear friends, of course the limb length discrepancies are going to be there because of the atrophy, and that's why there's going to be the gait disturbances, limp is going to be there. Now what is the problem is in the internal rotation, problem is in the abduction, okay. So just remember another male friend of mine, his name is Kabir, so you can remember problem in abduction and problem in internal rotation. So what is going to happen, because there's a limb length discrepancy, there will be asymmetric hip which will be seen on the X-ray, and the earliest finding is medial joint space widening. So there's a joint space which is there now, because the head is gone, so the joint space will be opened, there will be a medial joint space widening. Can you see? First of all, see this widening, okay, see this widening, okay, first thing. Second thing is normal shape and normal contour of the femoral head. See, this is normal contour, but that is abnormal contour which is going to be there, okay. So coxa plana, that means it's going to be a flat hip that is going to be there. Okay, and sometimes we see that a subchondral fracture. Now subchondral means, see, you have got a ossification center in the head of the femur. The ossification center in the head of the femur is actually irregular and often accompanied with the subchondral fracture. Often accompanied with what? It is often accompanied with subchondral fractures. It is often accompanied with subchondral fracture. Okay, so what is the goal? So the goal is to contain the femoral head properly within the acetabulum. Within what? Within the acetabulum, right? So this is something which you have to understand. So of course we have some non-operative modalities also, like we just observe, we give the physical therapy, we restrict the activity. So basically, if the child is more than 8 years, there are the risk of permanent hip dysplasia. That is why it's very important for us to operate this case. Okay, and what is the operative procedure? We do the acetabular reconstruction. We reconstruct the acetabulum to improve the femoral head containment. Okay, whatever thing is gone, but in order to improve the containment of the femoral head, we do the acetabular reconstruction. But in adulthood, these patients present with the osteoarthritis, they present with the progressive avascular necrosis, and of course, if it is a permanent dysplasia case, we have to do a early hip arthroplasty. We have to repair the entire hip joint. Okay, so hip arthroplasty is also indicated if there is a permanent dysplasia which is happening. So this was about the Legg-Calvé-Perthes disease. My strong recommendation, please undergo a revision of the topic of HCFA, because I've seen people confusing these two topics very much. So thank you so much for joining our session of pediatric orthopedics.